It has to be one of the least sexy items to talk about, and yet in terms of finances and paying bills, it is critical. We're talking to the coding expert, case study for optimizing provider production, and I got to tell you, Margie Amato, thank you very much for your time, but this really is an unsexy topic. What can you tell us that will kind of make it more exciting?
Well, when it comes down to it, the clinical details that get documented turn into codes which pay the bills, and they really do keep doctors out of trouble. When you think about it, compliance, core measures, all those things fall off of the same things. So if we can focus on the right details, we can maximize compliance, we can maximize reimbursement, and then folks like me stop bugging the docs.
And your title, by the way, is Revenue Cycle Solutions and Senior Consultant at MedAxiom. So what are the mistakes that are being made? How can they be fixed?
You know, it is very common in cardiology that they struggle with our evaluation and management rules. Every time a patient is seen, a physician evaluates and manages them, and that's how they get paid. But there are certain details of that don't maybe help the docs take care of patients, but they're necessary for the payment system. So cardiologists have the same problems. Reviews of systems, sometimes they miss a couple of details that cause them to be down-coded by coding people or regulatory auditors. And then likely, physical exams, same problem. A physician examines that which they need to take care of the patient, but then they don't throw in maybe another system or two to meet kind of the regulatory requirements.
In this year and in the immediate future, it is going to become more of a challenge. It's not just money anymore. Like you said, it is the regulatory factor that's going to be driving a lot of this.
It really is, and we're seeing increasing amounts of that. There's only so much money to go around, and when it comes down to it, our Medicare carriers and the RACs and the other organizations that help them, they are there to find any fraud or unnecessary money that was spent by our federal programs, and they are doing so.
I mean, we're now in January 2014. What do we need to remember and think about this year?
This year, the focus is this E&M evaluation and management coding. If there was one message I gave to the docs in my session, it was really focus in on acuity. Medical decision-making drives the level you build, and as long as you give clinical details and follow those rules, you really will land in the right billing level and keep yourself out of trouble.
And if you do get into trouble, how do you get out of it?
It's all about the documentation. You have folks like me and the professionals that work for the docs that can help provide guidance, but it comes down to what they documented. If we have enough clinical acuity details, we can argue any case. If you have a really short note, maybe a physician got interrupted, those are harder to fight.
And is there an oncoming train, anything we need to be looking for in 2015 or beyond that now might be a good time to think about?
Well, I think what the oncoming train is the new coding system for diagnosis coding. ICD-10-CM is going to hit the docs hard. Initially, I'm guessing that unspecified kind of diagnoses will still get cardiologists paid for what they do. But I think as all of our national and local coverage decisions get updated, that system's going to allow them the flexibility to pay for just the specific diagnoses or problems that they want to for each test or study. And I believe that the docs are really going to need the documentation to back them up. Without those specific details in their notes, coders can't code, and then they don't end up getting paid.
At ACC 14 this year, will there be some programs on this?
There is a little bit at the scientific sessions, and that's why meetings like the summit here are so vital, because we really do focus on practice management and kind of the administrative financial side of the business of medicine.
And that's in Washington, D.C. this year. So for people who would like to go to ACC 14, now is probably the time to start making your reservations. And for CardioSource World News, I'm Executive Editor Rick McGuire.